Good evening, everyone. My name is Jude Stevens, and I am the Wood County Coordinator for Healthcare for All. We, along with West Virginia Citizen at West Virginia Education Fund, West Virginians for Affordable Healthcare, West Virginia Center of Budget and Policy, and the Circles campaign of the Mid-Ohio Valley, welcome you to the Healthcare for All campaign's Wood County Candidate Forum. The West Virginia Healthcare for All campaign has one overarching goal: working to win the right to quality, affordable healthcare for all West Virginians. Since 1999, we have worked on bills that have improved lives and health outcomes in our state, like a bill that granted dental benefits to adult Medicaid recipients, put a copay cap on insulin in West Virginia, extended postpartum Medicaid coverage for from 2 months to 12 months, and have fought bills that would defund healthcare in the states. And we got our questions tonight by surveying folks all over the state to see what issues they felt affected their families the most. So we are happy to have you with us, and let's get started. I am going to pass it over to Lisa Doyle Parsons of the Circles campaign, who has graciously accepted to moderate our forum tonight.
Well, thank you, Jude. And again, good evening and welcome to the Wood County Regional Candidate Forum on Healthcare. This is the second of 4 statewide virtual candidate forums organized as part of the Healthcare for All West Virginia campaign. As Jude said, I am Lisa Doyle Parsons, and I'm the director of the Circles campaign of the Mid-Ohio Valley, and I will be your moderator this evening. The Circles campaign is a nonprofit organization committed to the reduction of poverty. Circles is a nonpartisan organization which encourages informed and active participation in government. At Circles, we believe that civic engagement is an important element of building strong communities, and we feel strongly that democracy requires the active participation of its citizens in order to function properly. Circles does not endorse any political party or any political candidate for elective office. And this forum also does not endorse any candidate or any particular party. As Jude may have mentioned, all candidates that were running for the House of Delegates were invited to participate in this forum. So first, I would like to thank all of our volunteers and sponsoring organizations that helped make tonight possible. And a special thank you to Brittany Rule, who is providing technical support this evening. Next, I would like to thank all the candidates for taking the time out of their busy schedules to be with us this evening. And lastly, I would like to thank all of you that are attending virtually, whether you're with us live or whether you're watching a playback. Your participation is helping to make this event successful. So tonight's forum will utilize a moderated question and answer format and will include candidates running for the West Virginia House of Delegates from districts 11, 12, and 13. While all of the candidates running for office in the previously mentioned districts were invited to participate, 3 have accepted our invitation. And is there any word on our 3rd candidate? Okay, so those that are here are delegates or candidate Harry Dietzler and candidate Andrea, otherwise known as Red Greer. So each candidate has been advised in advance of the rules and the questions for this evening's forum. Our timekeeper will be Jude Stevens, and if time allows, questions will be received from the audience at the end. I do wish to remind our candidates that this is a forum and not a debate, and that there will be no rebuttals. We ask that each participant and attendees be respectful, and there are no personal attacks that will not be tolerated. So at this point, I would like to offer an overview of our format and rules for the candidate forum. So each candidate will be given up to 1.5 minutes for an opening statement. Each candidate will be given the opportunity for a 1-minute closing statement, and the 2 candidates present will be given the same questions. Names will be in alphabetical order and rotated for each separate question. Each candidate will be asked a series of 6 predetermined questions and will be given 2 minutes to respond. As mentioned before, if there is time at the end, the candidates will receive questions from the audience, following the same format with 2 minutes to respond. Our timekeeper, Jude, will hold up a yellow card, or his background will flash in yellow when there are 15 seconds remaining. A red stop background will signal when the time has expired. So candidates, please wrap up when you do see the red card or the red background. And if you continue speaking for long after that, I will unfortunately interrupt you and just say thank you and move on to the next candidate. I would ask those participating to please be sure your devices are muted, especially if you are joining us. Please mute your phones or your devices if you are not a recognized speaker. So we will now officially begin our forum with 1.5 minute opening statements from the candidates. Our first candidate with his opening statement is candidate Harry Dietzler. Mr. Dietzler is a member of the Democratic Party and running for office to serve in the West Virginia House of Delegates for Delegate District 11. Mr. Dietzler, you have the floor.
Thank you. My name is Harry Dietzler. My dad pronounces it Dietzler, so I'm going to stick with that. And I came to Wood County in 1976 as a assistant prosecuting attorney. During that time, I began in my involvement with the community. I was a volunteer instructor at Glendale Gymnastics Club. None of you are old enough to remember that. And I was also a youth Sunday school teacher at Westminster Presbyterian Church. Later, I got recruited to be a women's softball coach, not because I had any special knowledge, but because I happened to show up and they called me coach from that point forward. And I learned so much from the woman who had never had a chance to participate in athletics before. I stayed involved with Wood County for the next 46 years. Kathy and I formed a foundation in 2001, and we've supported numerous charities, $800,000 in Wood County and 1.6 million total, trying to make the world a better place with what we can. And I've been involved in the board of directors of multiple charitable and public service organizations in Wood County. And also I had run for attorney general in 1988, and the voters said I was much better qualified to be in private practice. So I had to find a job, and I was briefly in Charleston due to that. And at which time I even served on Charleston City Council. So it's nice to meet y'all, and ask me any questions you want.
Thank you, Mr. Dietzler. And next we have candidate Andrea, otherwise known as Red Greer. She is a member of the Democratic Party and is running for office to serve in the West Virginia House of Delegates for Delegate District 13. Red, you have the floor, if I may call you that.
That's fine. Everybody does, and I hope everybody that's watching today feel free to do so as well. My name is Red. I live in Virginia, and I'm a Parker. And I'm very sad to see the direction and how hard it is for people who live here. We deserve better. We can do better. And I believe that doing better starts with electing real people into office. That means people who have experience with poverty, with food insecurity and homelessness and inability to access healthcare. All of those things are very, very important to me because I've experienced them. I've been in that cycle of poverty and where I couldn't quite lift myself up. I want to help people in that situation. I want to make things better for West Virginia, for Wood County, for Parkersburg, for my kids and for your kids and for all the kids. We have to do better. And I believe that we can do better by electing regular people into office, people who aren't concerned with adding and who really, really are concerned with representing their constituents and being a voice for the unheard.
Well, thank you, Ms. Greer. So now that we have gotten to know a little bit more about our candidates, we will proceed with the question and answer component of this evening's forum. So candidates, you will have 2 minutes to answer each question. And our first question goes to candidate Greer. On September 13th, the West Virginia legislature rapidly passed a policy to make abortion illegal and only narrowly defined exceptions. All while 1 in 8 West Virginian babies are born preterm, 14% of pregnant West Virginians do not receive adequate prenatal care, and 1 in 4 West Virginia families live below the poverty level. What are your plans, if elected, to expand funding and programs such as SNAP, TANF, and Medicaid that provide vital services to support families, infants, and children?
Well, obviously, those services are going to have to be increased. We are going to have to take care of more families because more children often leads to greater poverty. It's an unfortunate fact that children are extremely expensive to raise. I've raised a few of my own and they're not cheap. As far as food stamps, TANF, WIC, all of those things are going to have to be strengthened. We're going to have to increase access to those programs, and we're going to have to get ready to serve a lot more people. Now, to do that, we're going to have to find money somewhere. Unfortunately, we don't have a huge surplus of excess money here in West Virginia. But I think that we can do that by being a little wiser in where we allow tax cuts, in what we subsidize, and in how we use the money that is already allocated to us.
Thank you. And now for candidate Ditzler. Same question, but what are your plans to expand funding and programs such as SNAP, TANF, and Medicaid or others that provide vital services to support infants, children, and families?
Obviously, I'm in favor of the expansion. The challenge that we face is that anytime you need money for one program, you have to take money away from something else. And so that's the biggest issue is where do we find funding? And the second issue that we have to address is that to get any of this done, I have to get 50 other votes in the legislature on the House of Delegates, and we have to get more than half of the Senate. And so my plan is to work with members of both parties and see what we can accomplish. I think we have a paddle to turn a battleship, and I could go down there. My law partner said when I got elected to city council one time, you can raise a lot of cane all the time you're there and be on the front page and not accomplish a thing, or you can work with the people that are there and try to make something happen. And so I learned from working with 26 other members of city council and always getting the things that we needed, that you have to work with the others. And so my plan is to go to Charleston, be aware of these concerns, try to address these concerns, and do it through working with the other members of both parties to the degree that we can do that. and actually accomplish something.
Well, thank you so much for that thought out response. So our second question is to candidate Greer. We have talked to many individuals across the state who feel they must turn down an opportunity to work or earn more money in order not to lose their vital Medicaid coverage. Other states are using federal dollars to address this Medicaid income eligibility cliff. Using allowed federal funding flexibility, West Virginia can create a Medicaid buy-in for lower income workers funded with federal dollars. Would you support a West Virginia workforce development program that would allow low-income workers who hit the Medicaid cliff to continue Medicaid coverage through a Medicaid buy-in program?
I would support that. I've been in that situation myself where I had to choose whether to take a raise or whether to keep my health care. I have to keep my health care. I have health issues that require me to be on medication. Those medications are not cheap, and the raise would nowhere near have covered what I was losing, not to mention doctor visits and tests and all the things that go along as you're getting older and things are starting to not work so well. I certainly support having a Medicaid buy-in, and anything that can help people access health care more easily and more affordably in West Virginia is a plus, and we need to be taking action on that.
Thank you, candidate Greer. So candidate Ditzler, would you, same question, support a West Virginia workforce development program that would allow low-income workers who hit the Medicaid cliff to continue Medicaid coverage through a Medicaid buy-in program?
The short answer to that is yes. The realistic answer is I would support it to the degree that we can actually make it happen with the within the federal guidelines and within the budgetary constraints that we have. And I might add that I have I've had my time trying to make the ends meet too. I started as a dishwasher in the Rose City cafeteria, worked my way up to Bordenberger Foods, BBF they called it, and then Pizza Hut, and worked construction in my summers to get through all 7 years of school, and worked all the time I was at school. And when I got out of all that, I made $500 a month as an assistant prosecuting attorney. Everybody thought that, well, Harry must be a recovering alcoholic because he doesn't drink beer. I couldn't afford a beer, and I would never accept one when somebody gave me one, because that meant I had to buy them a beer. I couldn't afford to buy them a beer. So I understand what we're dealing with to a degree from personal experience. And I definitely agree that it makes no sense that you cut off somebody's Medicaid when they hit a certain level and they get a raise, and then they have to pay. Right now, my health insurance for Kathy and me even being on Medicare costs us over $30,000 a year. Most people in these jobs don't even make $30,000 a year. So yes, we have to take care of that.
Thank you. I will move on to question number 3, and this will go to candidate Greer as we continue in our rotational order. The question is, in the 2022 West Virginia legislative session, a bill was proposed which would have lowered the private insurance copay cap on insulin to $35 a month and add a copay cap of $100 on equipment, supplies, and other devices related to diabetes. Congress passed a copay cap on insulin in the Inflation Reduction Act, but that only applies to Medicare recipients. Would you support this or a similar bill to ensure that West Virginians with private insurance can afford needed insulin and insulin supplies to save lives and reduce tragic and expensive diabetes complications?
Yeah, I would, excuse me, I would definitely support a bill like that. Diabetes is one of the top diseases that affects West Virginians. And I know several people who have to ration their supplies, who have to take their blood sugar less often than they should because they only get a set amount of lancets and strips. People who are using insulin are cutting their doses in half or thirds or quarters, even trying to make it last longer. And that's just not sustainable because that causes people to die. We can't keep letting our people just die because a company won't make more money. Insulin is very old. It doesn't require research and development. It's not something that we have to be really concerned about it falling by the wayside because we forgot how to do it. We don't need huge amounts of money to be made off of that particular medication. And there are a lot of medications like that there's no reason for those medications to be so expensive except greed. And I believe that we owe it to ourselves to not allow that sort of greed to take any more lives.
Thank you so much. Candidate Ditzler, would you support this or a similar bill ensuring West Virginians with private insurance can also afford needed insulin and insulin supplies to save lives and reduce tragic and expensive diabetes complications?
I like the concept. My concern is that it's the question as posed doesn't show how it's really going to work out or what's going to be controlled. If you reduce the copay that's allowed, you increase the cost to the insurance company, and the insurance company is going to increase the cost of the premiums. So I'm not sure you really get what you want when you do that. So if we can do some research and figure out how we can, one, can we afford to do that? Two, can we get it so that it doesn't become a wash because the premiums are increased to cover the cost? I think it's a great idea. To do that, you have to regulate insurance companies, and you would have to cause all persons, all insureds premiums to go up. If you regulate insurance companies and say, well, you can't just do that to the people with diabetes, then you end up raising the premiums for everybody. And then the question is whether that is something that we can actually get through the legislature. That's a challenge that we constantly face when we're trying to help people, is getting the I only care about myself people in government to go along with us. And so my understanding of this situation says that I would have to talk to the other people in the House of Delegates and the Senate and find out what their feelings are and find out what we actually can get done. Again, if you cut the minimum copay, you're going to cause the cost of insurance to go up, and it might be hard to get people to go along with that. So it's a tough battle.
Thank you. So moving on to question number 4, and this will be for candidate Greer. The federal government
Can I interrupt just a minute?
Yes.
When you started out, you said that you were going to rotate the questions from one candidate to another. And I'm not sure it's fair to Red that she has to answer first time every time. I mean, I'm not begging to go first. I love to have her go first because it gives me some time to think about it. But I didn't know if you were doing what you really intended to do.
I would be happy to flip that. When our third candidate didn't show up, it threw off our rotational order. So if you would like to take this question first, then we'll keep flipping in that direction.
Well, not really. I'm glad to have Red go first. I just didn't know if I was being fair to her.
No, that is a good point. So we will go with you for this question first. Question number 4. The federal government is taking steps to no longer broadly subsidize free COVID testing, vaccines, and COVID treatment. The cost will transfer to patients via their premiums and out-of-pocket cost. do you see a future role for local public health departments to ensure that working West Virginians can afford testing and vaccines? What would you propose to help ensure that West Virginians can afford appropriate courses of treatment for COVID?
The question of whether there's a future role for public health departments is going to depend on whether or not they slide that amendment 2 through. If they slide amendment 2 through, they're going to take away the funding for counties because that comes from property taxes and other things. And the counties won't even have enough money to fund the health departments, much less fund additional programs through the health departments. So that's an issue that we really have to deal with, is making sure that we continue funding for health departments, and assuming that the health departments have the ability to pay for those things if they're adequately funded, then of course I would be in favor of it. And what would I propose to help ensure that West Virginians can afford appropriate courses of treatment for COVID? Again, it's going to depend on what we can get through 51 votes in the House and more than half of the Senate. And for me to say, well, I would do this or that, it's not realistic. I mean, I wouldn't be honest with you just to say I will do this or that, because I, as an individual, can't do it. And we have to look at the budget, and we have to look at what we can sell to the other members of the legislature, and then come up with a compromise plan that will actually accomplish what is best to get toward these goals.
All right, thank you for that answer. So Red Greer, candidate Greer, this question also goes to you. Do you see a future role for local public health departments to ensure that working West Virginians can afford testing and vaccines? What would you propose to help ensure that West Virginians can afford appropriate courses of treatment for COVID?
Well, COVID is going to be a concern for the foreseeable future. And we're going to have to keep people vaccinated in order to reduce the spread. As far as the local health departments have a role in that, I think that that's probably the most fundamental way that we can make sure that that happens, is to make sure that the health departments are involved in that, and that they have the funding that they need to carry out those tasks. As far as what I would propose, I am also concerned about what could be passed through the legislature, but I'm not willing to say that I won't fight for every person in West Virginia to be able to access COVID vaccines, COVID testing, COVID care if they need it. And figuring out how to pay for it is going to be hard. It's going to be hard because there are a lot of people that just don't care in our legislature, and that's a sad truth. But they either don't believe that it's a real thing, or they just aren't interested in helping the population, which is what we're supposed to be doing as elected representatives for our districts. We're supposed to be helping our population and representing our population and making sure that they have what they need. So yeah, we're going to have to make some compromises and do some working together to find the proper way to fund those initiatives. But it has to be done. It has to be done. And public health is one of the most important things that we can invest in. That and education. I mean, those are the two things that we need to be making sure we have done right.
Thank you, candidate Greer. So for the sake of fairness, since candidate Greer answered the first three questions first, then we'll go back to in order in which candidate Ditzler, this question will go to you. Question number 5. In November, West Virginia voters will be asked to vote on Amendment 2 that proposes taking 27% of personal property taxes, which are currently protected in the Constitution for local and public services, including critical health services, and will give the state legislature control over those funds. What will be the cost to our communities if we have fewer funds to invest in our schools and local public services? What is your position on Amendment 2?
Well, looks like I'm going to be agreeing with Baby Dog on this one, which is not always the case. But I cannot see. My personal position is I will personally vote against Amendment 2 because it's going to take away funding for our schools and for our health departments. And with all due respect to all the members of the legislature, I know every one of them is down there with his or her sincere belief that he or she is doing the right thing. I don't think there might be one or two that have a personal interest, but all of them generally are there because they really want to do what's right. And I think that my job is to help share the knowledge of the concerns that we're talking about and find out what these other legislators believe and why they believe what they believe, and see if I can help guide things so that they understand what those of us who have been involved in local government understand, because I was the advisor to the Wood County Commission for 13 years as a prosecuting attorney, that if they take away these local taxes, they aren't doing a favor for the people in that county. They are cheating their children. They are cutting back on health services, and they're going to make it very difficult, particularly in the smaller counties. I mean, what are they going to do? So I'm against Amendment 2 in its current format.
Thank you. Candidate Greer, same question. What will be the cost to our communities if we have fewer funds to invest in our schools and local public services? And what is your position on Amendment 2?
Well, I'll just start off by saying I think Amendment 2 is terrible. Please, please, please vote against Amendment 2. We cannot afford for our schools, for our counties, for our communities to lose that money. We cannot afford for it to become a political football in Charleston. We cannot afford it. Our education system is already bad enough. If we lose money to that, it's going to be even worse. And that's exactly the opposite way that we need to go. We need to be making sure that we are investing in education, investing in our communities, and investing in the quality of life that people can have in West Virginia. And Amendment 2 is going to really, really harm that quality of life. It's not going to be the panacea that people seem to think that it will be. It's not going to have a good effect on our communities.
Thank you. And the sixth question, starting with candidate Ditzler. Health equity means closing the gap between privileged populations and marginalized or vulnerable groups of people. In West Virginia, vulnerable populations include women, people of color, people with a disability, immigrants, the elderly, people experiencing poverty, the LGBTQ populations, and people without a high school diploma. A person's social identities and situations, including characteristics like their income, race, disability, education, age, gender, sex, and sexuality, can influence the rates of chronic disease and access to treatment. What do you think West Virginia can do to advance health equity and reduce health disparities?
I don't know. It's a challenge. I've been on a board of Public Justice, which is a national public interest law firm, for the past almost 30 years. And I'm past president of that organization. We have offices in Washington, D.C. and in Oakland, California. And we have stood up for all the vulnerable populations that you have mentioned there. And sometimes those situations have to be addressed on a case-by-case basis. I'm not sure that you can pass a law, particularly with the current United States Supreme Court, that's going to pass muster and even remain in effect. So I think the better or the more likely success is to continue to educate populations, continue to have people intermix and find out that other people that are different are not bad people. So many of our, unfortunately, so many of our people don't ever get out and about others, and they think that everybody is like them. And that goes for all populations. And so the key is to have public schools where everybody, well, for instance, when we were in Charleston, we put our kids in Capitol High School because we wanted diversity, and we wanted them not to have the implicit bias that so many people have. And it's still not successful. All of us have some degree of that. And it's a big challenge.
Thank you. Candidate Greer, same question. What do you think West Virginia can do to advance health equity and reduce health disparities?
Well, I think candidate Ditzler is correct when he says that education is key. But how to reach those populations to get that education out there is a real can of worms. You know, there are multiple populations in our state that do not have access to the care that they need. And that may be because they live too far from a place to get care. It may be because they don't have insurance, or they don't know that they can qualify for Medicaid and things of that nature. So we need to get out there and we need to educate those populations. And I think we have to go to where those populations are. And that's in the schools, that's in, the colleges, that's in the places that people gather, basically. That's not how I meant to end that, but we won't talk about that. I really think that without the education, we don't have a chance. But I also think that, again, our community health departments could be very, very involved in that kind of education. We have places like here in Parkersburg, we have Ritchie Regional, which is a healthcare facility that actually has offices on school campuses. So that education could be provided in places like that. It could be provided in multiple areas where we are interacting as a community, because the whole community needs to know about these things. It's not just a women's issue. It's not just a person of color issue. It's not just an issue for the minorities. Everybody needs to be educated about this.
Thank you. At this point, we are going to take questions from the attendees or the audience. And if you have the ability to use a microphone or sound, then you could ask permission to be unmuted, or you can type a question into the chat. So let's give it a minute and see if we have any questions. I guess I have a question for both candidates. So being of an organization that works with individuals and families in poverty, clearly there is a link between poverty and poor health outcomes. What could be done to address the issue of poverty in this state? How could we lift up families in this state so that that poor health outcome that we get because of poverty is reduced? So we will ask candidate Greer first.
For me, I think that we're going to have to create some incentives for making care available to impoverished populations. I'm not sure that there's really any other way to get for-profit entities to step up and take care of the community. I remember when I was a kid that corporations were good community citizens. They helped make sure that all the workers had health insurance and pensions, and they rewarded their loyal employees, and they put into the community. And unfortunately, that's not really the case these days. We have corporations running healthcare that are only concerned about the profit motive. And until we fix that, we're going to have to do something to incentivize those corporations to help care for our impoverished populations.
Candidate Ditzler, the same question. What can we as a community do to help decrease poverty so that those that are low income won't have the poor health outcomes that they currently do?
It's a challenge. We have to come up with employment opportunities, and we have to have a pay scale that allows people to survive. I keep saying all the things that I do like as if I'm trying to build up myself, but I'm on the board of directors of Legal Aid of West Virginia, and those are the people that have really desperate situations. And so I'm aware specifically of the issues that we're dealing with, but I don't know that it's something that the West Virginia legislature can independently solve. I think some of these things have to be resolved on the national level, and we have to have everybody on the same playing field. As an attorney, I have to bring lawsuits against the corporations that violate the rules, and everybody criticizes me for that. But when I am successful at that, it puts all the corporations on the same playing field. And so if the one corporation, the ones that are violating the rules, they're getting ahead of the others by saving money. And so I know how we deal with that. And then what you have to do is you have to have the rules that cause corporations to treat people fairly. And if everybody is under that same set of rules, then we'll actually get somewhere. But it may not. It's taken a long time. When I was a kid, as Red was saying, the corporations cared for their employees and did special things. That just, I can't remember, it was General Electric or who, they switched things to where all they were concerned about was profits, and to the detriment of the employees and the people as a whole. And so those are things that are addressed on the federal level, not the state level.
Right. Thank you for that thoughtful answer. We do have some questions from the audience. We'll start out with a question from Kathleen Stoll. And her question was, appropriate dental care is critical for West Virginians to stay healthy and productive. Oral health influences all of the body and all aspects of health. 2 years ago, West Virginia added a dental benefit to Medicaid, but the coverage is capped at $1,000 a year. Often, this does not fully cover the cost of fillings or other necessary dental work. Would you support rising this cap to a higher amount? This investment could save Medicaid money in the long run when other infections do not develop because of poor oral health. So the question is, would you support increasing the cap on the Medicaid dental coverage for adults? And this question will go first to candidate Ditzler.
Again, that's something that we have to look at the total amount of funds that are available and determine to what degree it's realistic to do that. If we cannot do that with the Medicaid funds that are available, it's not going to happen. If we can, it makes total sense that if we take care of dental needs now, it's going to prevent a lot of costs in the future. But each year has to pay for itself. In other words, if we save money for the future at the expense of the current year, it might not be something that we can actually do. We can talk about it all we want, but if it's not feasible, it's not going to happen. Same thing on private dental care. I mean, I think our private insurance coverage was limited to that amount. Well, I couldn't get this tooth replaced that I had here for the insurance coverage. I mean, it pays something on it. So it's not just at that level that people are missing the services they need, and sometimes it's a challenge.
Thank you. Candidate Greer, same question. Would you support increasing the cap, which is currently $1,000, to address those adults with Medicaid that need higher rate for dental coverage?
Yeah, I would support that. I understand what we're saying, money somewhere, and whether or not it's feasible. Whether or not it's feasible, I would support it. $1,000 is nothing when you are looking at dental costs. I went through a lot of dental issues because I couldn't afford dental care. And with my pregnancies, my teeth just went really, really bad. So there was a lot that I couldn't eat, a lot that I couldn't do. And I had a lot of lost time from work, a lot of lost time from being with my family, and some really genuine fears about whether or not I was going to live. Because abscesses, especially in the jaw, are extremely dangerous. They can easily infect the blood going to the brain. They can easily move to the heart. It's just a really, really terrible thing to have to try to deal with. And the pain from it is unimaginable. If you've never had an abscessed tooth, I've had kidney stones, I have birthed children, and a rotten tooth is absolutely the worst pain I've ever been in my life. So when you have something like that, you need help. You need the proper care to be able to stay away from getting to that stage in the first place. Preventative care is very expensive. Even just an every 6-month office visit can run a few $100s. So if you need something extra on top of that, then $1,000 is really not very much. Plus, there aren't a lot of dentists who take Medicaid. So it can be really difficult to get an appointment. I think if the reimbursement was better, if the cap was a little higher, then we might be able to have more dentists in the program and help more people.
Thank you. So the next question comes from Pam Lunsford, and it's kind of a similar question in that if you get elected, will you be doing anything to contribute to having eye care for adults with Medicaid? Currently, vision care is not included for adults with Medicaid. So would you do anything to support that in the legislature? And that would go to candidate Greer first.
Eye care is really important. Actually, my dad is disabled because his eyes started to go bad when I was about 10 years old, and it just continued because he didn't have the proper care for it. He wasn't able to find the right doctor that would take his insurance. So he's blind now. There's, you know, there's not much that they can do aside from possibly really futuristic stuff like bionic implants and chips and things of that nature, which also prohibitively expensive. So yeah, we need to be taking care of our eyes. If you don't have your eyes, you're much less likely to be able to find a good paying job. You're much less likely to be able to live on your own, as far as being able to go to the store and things like that, because there's no public transit in this area. So it becomes very difficult then if you are disabled, and especially for something that could be prevented, like eye disease that could be diagnosed far, far before it gets to the point that you're no longer able to see. And if we are taking care of people's health, we need to be taking care of all of their health. I've long been a champion of making sure that people on Medicaid were able to access services for their whole health, you know, their teeth and their eyes and their ears, and everything is attached to us. If we're going to take care of us, we need to take care of all of us. It's not a thing you can do piecemeal. Health is holistic. It has to be the whole thing.
Thank you. Candidate Ditzler, same question. Would you support eye vision coverage for adults with Medicaid?
Well, I would support it to the degree that it can be paid for. Again, we have federal dollars and a limited number, and I can support whatever I want, but what makes sense is to work toward what is realistic and what we can actually get done. And again, I would take a position supporting those coverages to the extent that it can be paid for. If it can't be paid for, whether you support it or not, it's not going to happen. And so we have to address those issues. I fully appreciate that people have issues with their vision, with their health, and other things that other people don't have. And the bigger picture is to make it so that all insurers cover all people. And although that may increase the cost for some of us who have been fortunate to only have little things like heart stents and stuff, it's not the increase, I think, is fair. But when the challenge is, okay, you can't make private insurers do this, and it's not sellable to have a national insurance to handle all these issues. And so there's a balance there, and it's horrible in my mind that there's an inequity, that people that are born with certain problems are going to get shortchanged no matter what. And if I thought we could solve that, I would do everything I could to solve it. I don't know that it's realistic in the West Virginia legislature or any other single state legislature. I think it's a federal level thing.
Thank you. So we have one more question from Jessica Ice, and that question would go to candidate Ditzler first. In your mind, what is the most pressing healthcare issue in your community?
That all depends on who you talk to and how that person is impacted. I mean, I have law partners that have had kidney transplants. That's a big issue, and I think a lot of that arises from diabetes. I think a lot of our healthcare issues arise from a lack of education, and I don't mean schooling. I mean the breadth of education as to what each of us needs to do to try to stay healthy, because we have one of the most overweight populations in the nation. And that is not because we're poor. I mean, poverty does affect that, but they had an experiment up in Wellsburg, West Virginia, where they provided exercise programs and everything, and they brought about the wholesale change of the whole community, and they had a healthier situation. And so the healthcare issues that we face can be addressed through education, where you get participation and people knowing what they need to do to stay healthy. And again, that's not going to prevent things that we inherit, but overall, it would have an enormous impact if we could do that statewide. And that's another reason why I wouldn't support, was it Amendment 4 that says the legislature is going to tell all the Board of Education what to do. I don't think people in the legislature know what people should be taught, and I don't think individual beliefs should be the basis for our entire education system.
Thank you. Same question to candidate Greer. In your mind, what's the most pressing healthcare issue in your community?
Well, it's really kind of a trifecta. Diabetes, obesity, and heart disease. These are the things that are really, really impacting our population here in Parkersburg, especially our population of a certain age. As we get older, our lifestyle choices catch up with us, and sometimes they do it in a really calamitous and cacophonous way. But we are, I feel like we are obligated to try to make the best of what we're given. And those healthcare issues are, I mean, yeah, a lot of them are just the result of lack of education. I mean, there are a lot of people out there who don't know what a good meal looks like, what a properly balanced meal looks like, what portions should look like. There are a lot of people who are born predisposed because their parents or grandparents had these issues. So you end up with whole families that are afflicted with diabetes, with heart disease, and with obesity, because these are all genetic issues. And yeah, the exercise programs, I think, would be a great opportunity here in Woods County if we could get people to utilize them. I think a lot more important is having proper sidewalks, having the ability to exist in a community here without having to rely on your car to go 2 minutes down the street, so that you're not getting hit because you're walking in the road because there's no sidewalk, or you're, you know, just not able to get there on your roads because it's heavily trafficked, or for whatever reason. You know, it's not very walkable here, and it's not very easy to get healthier. And I know, because I'm trying, but it's those diseases are really, really harsh on our community, and I think that we could do a lot better than we do in helping people understand and remediate that.
Thank you. So I want to thank you both for your insightful answers, and clearly we appreciate that you have really committed the time to prepare and give thoughtful consideration to these questions related to healthcare. So at this point, we want to move on to our closing remarks. And with the closing remarks, we will start first with candidate Greer. And we have a question to address for your closing remark. And that is, as you know, this candidate forum is being hosted by the Healthcare for All West Virginia Coalition of Organizations. Those include West Virginians for Affordable Healthcare, the West Virginia Center on Budget and Policy, and the West Virginia Citizen Action Education Fund. What does Healthcare for All mean to you? And what steps do you envision to expand access to quality, affordable, comprehensive health care for all West Virginians?
Well, healthcare for all is pretty self-explanatory. It means everybody has healthcare. Everybody has access to healthcare. Everybody can use that healthcare. Everybody can benefit from their healthcare. That's what healthcare for all means to me. What do I see as being part of achieving that goal? I think that we need to, especially in light of the last couple of years, we need to look at what the poverty line is in West Virginia and recalculate that, because the cost of food has gone up astronomically just in the last 6 or 8 months. So a dollar doesn't buy what it used to. So healthcare for all for me means that we have to expand the access to Medicaid. We have to expand the access to Medicare. We have to expand the access to community health centers. And by doing all that, I would hope that everybody would be able to access healthcare.
Thank you. Candidate Ditzler, the same question. What does healthcare for all mean to you? And what steps do you envision to expand access to quality, affordable, comprehensive health care in West Virginia?
To me, healthcare for all means that if any person comes down with a situation that requires health treatment, he or she can acquire that treatment. To do that, to the degree that it's feasible, we can expand Medicare, Medicaid, and beyond that, we have very little power in the state of West Virginia. And I don't think there's any national push to combine all the insurance companies, health insurance companies, and regulate them. So I mean, realistically, that's not going to occur. And so what we have to do is look after one another, like I say, like we do in legal aid, like we do in public justice, like we do when we contribute to the United Way and other organizations. Those of us that have the ability have the responsibility to do that.
Thank you. So you have both certainly given us a lot of things to think about, and I want to offer my sincere appreciation for your desire and your willingness to give of yourselves to do the hard, tiring, yet essential and inspiring work necessary to make West Virginia a place we can proudly call home. So thank you to both of our candidates. Thank you to our volunteers and sponsors. And lastly, thank you to those who vested the time to attend this evening or will be watching it later in playback. We hope this has been beneficial to you. As Thomas Jefferson once said, we do not have government by the majority, we have government by the majority who participate. So we want to encourage you to make an informed decision and get out and vote. So at this point, I want to turn things back over to our host, Jude Stevens, for a final wrap up.
Thanks, Lisa. And I definitely appreciate the candidates making time and considering these questions that we've asked tonight carefully. I would also like to thank the West Virginians for affordable health care, the West Virginia Citizen Action Education Fund, the West Virginia Center on Budget and Policy, and the Circles campaign of the Mid-Ohio Valley. We would also like to invite everyone to our last two forums in Monongalia County, which is on October 11th, and Kanawha County on October 18th. There should be information in the chat below. Hopefully someone takes care of that. And finally, we encourage you to do one of the most important things you can do as citizens. Remember to vote. The deadline for voter registration is October 18th, so it's right around the corner. October 26th through November 5th is early in-person voting. Make sure you show up, bring your ID. November 2nd is the deadline to request an absentee ballot, and November 8th is election day. Polls will be open from 6:30 a.m. to 7:30 p.m. Make sure you have your ID again. And November 8th is also the deadline to mail in your ballots. Again, it's big that we as a society and as citizens vote for the things that we find important. And I would like to thank everyone for attending this forum.